I'm Jared. I am one of the co-founders at Coherent Healthcare, where we are focused on stopping leakage across the patient journey. We know that keeping patients on track improves clinical outcomes and also improves commercial performance. I'm here today with John. John, do you want to introduce yourself?
Hi, I'm John Chinegwundoh. I've been in private practice for over 20 years, built my brand, built my practice, but I know things are constantly changing, so it's really great to hear what's happening in the field and really understand how I can make my practice even more efficient, more inviting for my patients, and cut down all that heavy lifting that we do behind the scene.
Great. Well, it's a great segue, this idea of heavy lifting.
Yeah.
So wearing your practitioner patient-facing hat, when you think about heavy lifting, what's on your list of the things that are heavy that you have to lift, that you probably don't want to lift?
Yeah. It's the constant trying to fill those clinic slots. So some weeks you're really, really busy and patients are screaming because they haven't got an appointment that week and you have to push them back to another week. Other weeks it can be quieter. And what is be really helpful is that a lot of it becomes automated. I work in different hospitals. They all have different appointment systems. I've got a really, really experienced PA, a really experienced secretary who has been doing this for many, many years, and she's brilliant at what she does. But if I could replicate her 5 times over and work 24/7, because often people think at 8 o'clock in the night, oh my God,
I need an appointment, I need a thing.
or I have to cancel because I've got a meeting at work and I can't come in as I thought. Even though we do video consultations and telephone consultations, people's plans change all the time. And to have a way that's much more automated and much more easier for all concerned, both the patient, but also for us as the clinic. So we don't, and sometimes when people cancel, they don't rebook straight away, and then it goes out of their mind. Weeks, months go down the line, and we don't have the capacity to keep chasing them. But if we had something in the background do that for us, it'll be amazing.
So it's interesting. I think you're describing this experience of white space in the calendar. You've got, you show up for work, you're ready to see patients. Yes. You've got 2 patients in the morning, space in between them. You've got 3 patients in the afternoon, a bit of space in between them. There's obviously this question of, is this the best use of my time? Are there other people that I may be putting off that want to come see me now? When you say you have a really experienced PA and he or she is helping you manage the diary, why can't they do this? I mean, if they're that good, why can't they do it?
Because there's only so much time for them to do that, because they're doing other things. They're prepping the clinics, they're chasing out results, they are dealing with invoices and billing and taking all sorts of inquiries by telephone. As I said, they could be replicated and do what they do really well. That'd be brilliant, but they have lots of other things to do to make their practice run, to make sure the results are there for the appointment, to make sure that all the things that I need to deliver that clinic appointment is ready for me to go. So that's why any support they have, just like we've adopted scribes, an AI scribe, to really take out all the typing and all the admin and do all the referrals automatically. A year ago, we weren't doing that. Letters had to be typed, letters had to be checked, forms had to be filled out. Now all that's automated. We're thinking, how do we ever survive before we did this? But those 3, 4, 5 hours a week that it saves means we've got more time to do other things. But there's still, unless you want to hire more and more backroom staff to do all these tasks, which obviously eats into the profitability of the business, then you're going to really be thinking, how can I do this in the most efficient, automated way possible? And that's why I think you come in with all your novel ideas, and it changes all the time.
So it's interesting. I think a lot of the inefficiency and the efficiency that you're describing, understandably, is the patient on that day.
Yes.
How many years have you been in private practice?
22.
22 years. 22 years. How many patients do you think you see a year? Best guess.
Let's say it's 1,500 patients.
1,500 patients a year, times 10, 15,000, times 20, 30,000 patients.
Yeah.
You have 30,000 patients. You're a respiratory physician.
Yeah.
So when people come to see you, it's not they sprain their toe.
No, they've got serious problems.
They've got serious problems.
Yeah.
They're coming in for an issue. And I think you're absolutely right. A huge amount of the inefficiency is around the day. But what about those 29,000 patients
Yes.
who you saw. Obviously, you have a duty of care to them.
Yes.
You care about them. You want them to do well. I'm sure your PA also cares for them in whatever way they care for them.
Totally, yeah.
When's the last time they've heard from you?
We rely on a very much a reactive system. When they feel there's a problem, they try and get in touch, and they may or may not get in touch, and they may or may not get through and go and see someone else, or just delay the problem. So that is also an issue, because with the capacity we have as far as the backroom facilities we have and the backroom backup we have, we just can't be keeping a track on all those thousands of patients, because we tend to deal with a problem right in front of us. The people who are more urgent, the people who have an active problem, the people who send you 3 emails, that's what you have to deal with then and there. And someone who's fallen off the pathway, you're hoping that they will come back, but we just don't have the capacity. But it'd be great to have a really clever way of touching base with this. Are you okay? How are things going? You know, you're meant to come in for your 3-month checkup. You know, you're meant to have those breathing tests done. That'd be amazing. And also with my work, like doing a lot with asthma where it's seasonal, it'd be great if we're now in early March, I'm saying you need to have your March, April review, because the springtime pollens are going to kick in and you're going to be in trouble. Don't wait for it to become too serious.
So it's interesting to hear that. So one of the hypotheses that we have is that most healthcare practitioners, doctors, consultants, etc., if they had infinite hours in the day, our belief is that they would make it a priority to follow up with every patient.
Yeah.
If they had infinite hours in the day, because as you're saying, you saw someone a year ago, it's asthma related, it's that time of year, but you're intellectually carrying the caseload of 1,500 patients. 2,000. How many people? I mean, there's a limit. There's a ceiling.
Exactly.
And so I guess if you had a magic wand, if we gave you a magic wand and we said, forget hours in the day, forget cost, forget everything. If you could wave your magic wand and you could address those 29,000, 30,000 patients over the last 22 years, many of them I'm sure have moved away or successfully discharged. So maybe it's not 29,000, it's 15,000, whatever the number is. How would you, as an expert practitioner, what would you like to be able to do that you can't do today?
The great thing would be able to somehow make contact, and it could be an update, because they'll all have a diagnosis. So if they've got asthma, you'd be like, these are the latest things that have happened in the asthma world. I hope you're well. I hope your medications are still working. But if not, these are some of the things you may want to think about as new treatments. The same would go for people who've smoked, smoking-related diseases. You know, we have loads of advances on detecting small early lung cancers now that are life-saving.
Which may not have been possible
even 3 or 4 years ago. Now coming online will be molecular testing, so you can test in your saliva, in your blood, for small fragments of abnormal cells. These are coming online. They're not oven ready quite yet, unless you've got really advanced disease and when they show up, but in the very near future there will be. So it'd be great to be able to have some sort of platform to make people aware, and for people who feel, yeah, that sounds like me, I should get that check, or is my lung function test really as good as it was 3 years ago? I love running, but I can't run as fast. Is that just aging, or is there something actually not quite right with me? What's normal aging and what's not? Those sort of questions often come up, and it'd be really great if I could, have that capacity to reach out to them with an update, and then they can then get in touch and say, well, actually, I was thinking about this, or I was worried about it. And I think lots of doctors feel that way. Prevention is definitely better than cure. It's much better to get people earlier on.
So it's interesting. Obviously, we do a lot of work on, reaching out to patients.
Yes.
And oftentimes what we find is that the stuff that comes back is a very mixed bag. In one instance, a patient went in for a minor operation 12 months ago.
Yes.
They weren't happy with the outcome. They felt it was impacting their personal life, their mental health. They were considering litigation.
Wow.
That's obviously one end of the spectrum. On the other end of the spectrum, it's, oh, thank you so much for checking in. Actually, I probably am due to come back and see you. I've got kids, life is busy, whatever it is. Life is busy. There's a lot going on. It's not easy. We sometimes see things like, oh, I had an appointment actually, it was supposed to be in for 2 months ago, but I got sick and I had to cancel, and I just
It went out of my mind.
went out of my mind. I just forgot. And
That happens in every single clinic I do. At least 2 or 3 of the patients would have said, I know I was meant to have come back then, but I'm really sorry this happened, or something happened, or there's a work problem, there's a family issue. And that's very normal. And we all know in our own lives how we sort of need a nudge to, do things that we know are on our to-do list, but life gets in the way.
so I guess the interesting thing in there is you've got what the patient should do,
Yes.
and what the patient actually does.
Yeah.
And I'm imagining in your experience, those aren't always the same thing.
They're not always the same thing. Even with the best intentions, people just feel, because you start to feel better, it becomes less of a priority. When you're really ill, you can't sleep because you're coughing all night. You want an appointment at first thing in the morning, don't you? That next morning, you must see the doctor and get it sorted. But once that your symptoms are better, the treatment's working, you may have a little background cough still, but you'll still think, I can manage this. And until it starts escalating again, you don't do anything about it. And what we don't know is in those circumstances, what's actually happening internally is that your lungs could be getting worse and worse. And that could be giving you long-term problems. So it's important as part of the education process and the awareness process that people realize you've got to be proactive in your health and getting seen and getting your condition fully controlled, not suboptimally controlled or almost controlled, but fully controlled. And that's really important.
So I'm interested, you were saying just before, sort of changing hats for a minute, you were saying before the private healthcare space in the UK has changed considerably, dating back 10 years, 15 years.
Yes.
One of the words that you used earlier was competitive.
Extremely competitive.
So,
which is good.
yeah,
It raises everyone's game, it raises all the standards, but you have to be very clear what you're offering to a patient. Gone are the days where a patient will see a GP, the GP say, you must go and see John Chinegwundoh, they'll come and see me, I make a diagnosis, start the treatment, and everyone's happy. Now people do their own research, they talk to friends, they talk to family, they use ChatGPT, they have all sorts of ways.
show up with opinions. Yeah.
Which is good that people are more informed, but it also means as a practitioner, you've got to step up. You've got to be visible. People have got to know who they're going to see, make sure that you're someone who's actually up to date. And there's a lot of trust there. So how I present myself, how I come across on my website, for example, is really important. And that really helps in so many different ways. Not only are they more likely to come and see me, but also when they come and see me, the trust is already there. And when I say something, they are more likely to adopt it and think, yes, he's right, he's made a diagnosis, I trust him, I'm going to follow the plan. And then they get a good outcome, and I get that job satisfaction that I've done a good job.
You've done your job.
Yeah.
It's interesting in some of the, I guess, more elective-based care practices that we work with, that idea of that trust, we see it can be incredibly powerful, particularly at consultation stage. A lot of patients will come in to explore a thing, a desired outcome, whatever the nature of the treatment course might be, and the extent to which they can feel as though they've been heard, the consultant practitioner understands and also can articulate the journey from here to there is really important. And one of the things that we find is that sometimes patients have that great experience, that great conversation. They leave with a document, a plan, a note, an AI-generated next steps, whatever it is. Patient goes home, thinks about it, talks about it with their partner, with their friends. I'm thinking about X.
Yes.
And then nothing happens.
Yeah.
And the reasons are extraordinarily varied. In some cases, maybe it's price sensitivity, fair enough. Yeah. In other cases, it's, I had a question that I forgot to ask, and I don't know how to ask it now, and so maybe I just won't.
Yeah, just leave it.
I'll just leave it.
Yeah.
And so I guess the question I have on the practitioner side, think about your own private practice, and I'm sure your colleagues and friends in industry, this idea of accessibility as a patient, it's hot and heavy when you're in the room. You get the answers you need, you get the advice you need, and then when you're gone, you're gone.
Yes.
How do you as a practice leader, how do you think about making it easy for patients to engage, re-engage, communicate with you? I mean, they're ultimately coming for you. They're not coming to speak to the PA. They're coming to speak to you. How do you think about making that easy?
Think the number one thing is that the consultation you have has to be well documented, so that when I always write a very detailed report after each patient I see. So some of the questions as they walk out the room, they forgot to ask, when they get that report within 24 hours, land in their inbox or through the post, a lot of those questions will already be answered, but they may still have other questions. And some people feel able to just drop an email, which I think is good for lots of people. It's convenient. They get the answer they want. Other people may have a question that may require more face-to-face time. And it's really important that you articulate which is the best option. Is it that, oh, actually it's in the letter, it's just in that paragraph you may have missed it? Or is it, drop me an email and I'll answer your points? Or actually, this is more complex. You know, you're embarking on perhaps a very big process, a big procedure, something that's going to be life-changing for you. Mm-hmm. It's not a decision you're going to make lightly, and you may need a second appointment with clear questions of what you want to ask. And I think that's how, as clinicians, we don't always know which of those avenues. We're waiting for the patient to be very proactive and ask us, but maybe we need to do more to say, how did the consultation go? Do you have any further questions? Over and above what we was discussed in the room.
It's interesting. One of the things that we hear as having changed a lot, I'm thinking about some of the MSK practices, chiropractic, physiotherapy that we work with. We often will ask, what is the biggest change in terms of your patient body 10 years ago today, 15 years ago today? And when we started asking that question, it was very much with the intention of surfacing things like you just said. They show up with ChatGPT answers. They are more agentic over their healthcare. They take a more active role. It's not just come in and listen. It's come up with questions and answer. And that's part of it. The other thing that we consistently hear is my patients don't respond to me by email. People get a lot of junk in their email and they miss it. And one of the practices in particular, I remember asking the practice owner, what is the number one thing that has changed for you in terms of your patients? Said, the biggest change for us has been going from snail mail letters and phone calls to patients wanting to WhatsApp us. They want a WhatsApp. They don't want, they don't want
instant, it's fast, and you know you're likely to get a response in a very timely fashion compared to an email even.
How have you, I mean, I don't know the extent to which you communicate with patients over WhatsApp, but what is your view of the informality of those channels?
I think the thing is, we live in a much more instant society. So as doctors, we need to adapt to that. Obviously, many doctors are very busy seeing patients in clinics, doing procedures, operating, all these things. So you're not always on your phone to respond, which is why traditionally we've done emails, because at the end of your working day, you can spend half an hour going through your emails. But if you work closely with a good PA or an assistant, probably half those questions could be dealt with because they are straightforward things that recur all the time and the answers are quite straightforward. But certainly more complex questions where you have to think more, then you may need to do the email. But some things, a WhatsApp message can be, oh, I thought I was meant to take this medicine 3 times a day, but is it 2 twice a day? And you can get a quick answer like that. It depends on the nature of the query. But I think what we're trying to get across is that as practitioners, we have to be much more flexible and much more responsive to what the modern patient needs and wants.
So it's interesting, this idea of responsive, and you mentioned AI scribes earlier. Obviously, the benefits of AI scribes are, I guess, patient gets notes quicker,
so much, they get
much faster.
Same day.
You get time saved.
And also there's much more time you can spend in the actual consultation, listening
and focusing on the patient,
rather than head down, typing or scribbling. And also your administrative staff as well, the admin staff.
Don't have to do the typing, don't have to
do all this, it's all automated. So it means they've got more time to listen on the phone, to talk to people, to do other important aspects of the patient care that happens
in the room. So one of the things that's true of those AI scribes, obviously, before correspondence is sent to the patient, you look at it.
You have to.
You read it. You check it.
Because it's not always 100% accurate. So it's really important. So while it's time saving, you've got to be very clear that you must be the final arbiter of the quality and the accuracy.
So if we take that logic, medical scribes, I think, was the first rocket ship takeoff trajectory in healthcare for obvious reasons, and it's a huge benefit. The one that seems to be trailing very closely behind it is the AI receptionist.
Yeah.
Everybody loves the AI receptionist. And I guess I'm sort of curious from a practitioner perspective, using that logic of it saves me lots of time and I need to do the last 5%.
Yes.
You're running a practice. What would be your view on an AI receptionist that does simple things like reschedules an appointment, but also may end up on a call with a patient who's calling in with a lung issue or some other issue that may require a different kind of handling?
So many other parts of our life is the norm now, isn't it? You call the bank, you call a company to deliver you something. You have to go through 2 or 3 stages sometimes when you do get an answer for most things, but things that get a bit more difficult, then you get to speak to someone who gives you the answer of what you need. So I think in healthcare, we may be a bit slightly precious in thinking that patients wouldn't like it or we're not really geared up to that. But I think people do want answers more and more in more detail, and they want them quickly.
As a practitioner and someone who's working in private hospitals, private practice, there's obviously this, we talk about your patient body. You see 1,500 patients a year.
Yes.
You've got 30,000 patients over the last 20 years.
Yes.
Private hospital adds some zeros to those numbers, right? That it just get bigger and bigger and bigger. And I guess if you wear your sort of hospital leader hat for a minute rather than practitioner, what is, from a hospital leadership perspective, what are the 1, 2, or 3, if you can even have 3, 1 or 2 strategic priorities you think will define the next 5 years around this topic of patient engagement, patient interface, patient access? Obviously, there's a lot happening inside the 4 walls of the private hospital, but what about all the things that happen outside the 4 walls? If you're thinking about the next 3, 4 years, what does the future look like? Or what should it look like for those providers?
I think artificial intelligence is going to just change things completely. So many of the steps that we take now, even when the patient comes into the room and for the first time, and we take a clinical history, what's wrong with them, how long it's been like that for, their past medical history, whether they smoke, whether they drink, all those things that probably take 20 minutes to get all that information to the patient. A lot of that would just be automated because you send out almost like a preloading before the appointment.
Intake,
And a lot of that stuff would come out. So you'll have much more time to actually think about what's actually going on and obviously clarify a few points that may not be clear, but a lot of that will happen ahead of time, which means care will speed up. But there's only a finite resource of healthcare practitioners. So if they can spend less time per patient getting, sort of standard information out and focus on the really more complex or the more challenging aspects of differentiating what's going on with the patient, then we will see much improved outcomes as far as people being seen faster, not on a waiting list for weeks or months. And then also decisions being made much more quickly. Because one of the things we have, certainly in the public health system, is we have resident doctors who are learning from more experienced doctors, and their supervision is really important. As a senior doctor, I've got to see my own patients as well as supervise the patients they're seeing. But hopefully by bringing in more automated ways of getting the information from the patients, scheduling tests, all those sort of things, there'll be much more time to equip the new generation of doctors coming through to make sure they have the proficiencies that will make them great doctors.
Makes perfect sense. Yeah. I think just in the sort of final question, what is in the last 12 months, 24 months, 36 months, the world has been sort of hit by generation large language models. Yeah. It's all sort of hitting at once. Yeah. If you had to roll the clock forward 5 years, 6 years, 7 years, there's no shortage of new challenger brands in healthcare right now that are pursuing the vision of AI doctor or AI native X, AI native clinic. Obviously, there's some parts of clinical care that until a robot is physically touching you will just not happen. But there's a lot of the care pathways you're describing, the pre-intake, intake, that can in fact be offloaded. Where do you think, if I'm opening a new practice tomorrow, the game has changed for me in a way that it wouldn't have been the case 5-6 years ago. So if you're thinking about the next 5 years, what is the sort of guiding light at the end of that? How do you track this as the waves are moving? How do you track the thing through?
I think it's a really great question. And I think the key is this. When I'm on my phone having a bit of downtime and you go onto social media, you get constant adverts from people saying, you need to learn about AI. You need to do this tutorial. You need to know. And unfortunately, I don't have the time in my working day to do that. But I instinctively know that if I don't know all those new AI ways of working, and I will fall behind. So I know that either I see fewer patients and I devote more of my time to becoming more tech savvy and doing an AI course and learn all these new things, or I have to ally with someone who can help me. Say, John, this is your practice. These are the challenges. These are what your competitors are doing. We're going to hold your hand through this process because we know you haven't got the time to do it all by yourself, but we're going to make sure you're equipped at each stage. And it changes every month. So even if I was to do an AI course today, in 3 months, a lot of it would be obsolete. So I think the key is that we're going to, just like I have a PA that runs the office, I'm probably going to need to have some sort of tech partner to help me be the best clinician I can be, which will mean great outcomes for my patients, but also the quality of my life and being a practitioner, not getting burnt out, will also be really valuable. I think that's the thing that I've really learned, and I can see now, that you can't possibly keep up with all the new things that are happening. If you're a full-time doctor running a very busy practice, you can't. So you really need to think who you're going to ally with to do that journey with you and keep you up to date, otherwise you'll fall behind.
Now you're running a private practice. And so you're doing that, and you're also running a business. And I think in our work, we have a lot of practitioners, many of whom, similar to yourself, started in the healthcare side of the house and then ended up overtaking parts of the running of the business. I think there's this unhelpful cliche that doctors or healthcare practitioners are not commercially savvy. And I say unhelpful cliche because I don't know many healthcare practitioners or doctors who have not found a way to make very successful careers of themselves. So obviously there's a savviness that is just natural to people who are achieving to the standard of a medical practitioner. And at the same time, there's a reality or an operational reality around running the business. You were saying earlier, I have a website, it's competitive, I need to think about diary optimization. There's a whole operating function that probably is different or was different, and you've had to, so what was that transition like for you as a practitioner into the business side of the clinic?
I think it's really a great thing to think about because, if you go back a generation, doctors were seeing patients and they may see some private patients on the side, but it wasn't the core of what they did. Over time, people have become lots of people have portfolio careers. So they work 3 days a week in the NHS, 2 days a week privately, or they work as a medical legal expert half a day a week. So people have become much more adept at wearing many different hats. And even in the public services, so even in the National Health Service or in other, you run a school, if you're a head teacher of a school, you have to be business savvy. There's only so much money to run your service, to get this value for money, and you have to understand where you can make those efficiencies, what tasks can be done in an automatic way, and so forth. You need to know that. And one of the big problems I think we have in the health service, and many of us are talking about it, is that we don't spend enough time talking about management and leadership through our medical school education, when we're resident doctors, when we become consultants or running GP practices. We need to build in that management know-how and structure because we're the best placed to do that because we understand the patients, we understand what needs to be done. So there is a big push to get more leadership, more management training for healthcare practitioners as in many professions.
To prepare them for that journey that they're going on.
If you look at the most successful healthcare systems in the world, if you go to Germany, if you go to Japan, if you go to South Korea, the people that run their healthcare systems, that run their hospitals, are often doctors. Whereas in the UK, it may be under 5%. So it's a tiny fraction of healthcare practitioners in the public service are running the system. And we need to learn from places in the world that
have figured out the way to deliver that.
Absolutely.
So it's interesting. You mentioned at a national level, sort of Germany, South Korea, Japan. But I think what you're describing, and we see this in the practices that we work with as well, there are some healthcare leaders, be they large systems, small systems, solo neighborhood practices, secondary care, all the way through to private hospital or NHS. There are some that have a commercial rigor and ambition, be that on a private side, it might be a growth or a commercial ambition. And on a public side, it might just be an efficiency, a desire to fulfill the mission ambition. They seem to be playing a different game. That game is about improvement. It's about the next thing, the improvement. And we one practice comes to mind for us that we work with. It's a dental group, and when we first started speaking with them, we connected with the COO, and we said, "Listen, it'd be interesting to learn about how you do your patient recall." And he said, "Oh, we've got that sorted." And 5 questions later, you realize you don't have that sorted. And so I think there are some healthcare leaders who are open to the idea that the way I've done this for the last 5 years is not the way I necessarily should do this in the future. But I'm curious, in your network, in your circles, people you spend time with, what is different about the people who are pursuing that trajectory and the people who aren't? How do you sort of separate those two groups?
I think when I think of, friends, colleagues, people I've known for 20, 30 years in healthcare, who I've been at medical school with, who I see regularly, the people who are achieving the most are those that are aware of their own limitations, but most importantly, they're the people who are the most curious. Curiosity makes you look at things in a different way, makes you ask questions, makes you look at people in other industries who aren't in medicine, but in law, in architecture, in corporate structures. How are they doing it? Can I apply those same rules, tactics, strategies for what I do in my practice? So people I know who are most successful have a wide network. They listen carefully to people doing things in other industries, and then bring it towards their own day-to-day, their own practices. But they remain curious. But the more curious you are, the more you realize there's so much out there. You can't do it all yourself. And that's when you need to make sure you're allied with people who can help you on that journey. I'm sure if I spent 2 or 3 days, I could write my own website and, do that, build my own website.
You also have other things to do.
That's what I mean. So it's not that you can't do all these different things. You got to say, what's the best use of my time, especially if you're trying to run a business and grow your business and provide great patient care. You got to say, this is what only I can do. This is what my real expertise is. But I'm curious enough to know that I've seen this is a great way you could do this website, or this great way you can engage with patients, or this is a great way you can make your clinic slots more easily utilized. So these are the things, but it's about curiosity and know what your limitations are, know when to get help in, and choosing wisely who you get to help you.